Shame isn't just a painful side effect of sexual addiction. It's the fuel that keeps the fire burning. If you want to stop the behavior, you have to work on the shame.
And if you go back to the addiction, you're going to feel shame when you act out again, which piles shame on top of shame, pushes you back into the addiction cycle, and then the cycle feels like it's never going to end.
When we talk about sexual addiction, we focus a lot on the behavior, the inappropriate content, the acting out, and the secrets. But today, we want to talk about the invisible engine underneath it all, shame. Shame tells you that you are broken, unlovable, and beyond help. Ironically, that feeling is exactly what drives you back into the addiction.
And that can play itself out where the person who has the addiction, who's acting out, can project their shame onto their partner, which creates more damage and pain.
So here's how the cycle works. First, you feel challenging emotions like pain, stress, or loneliness. You don't know how to soothe that in a healthy way, so you act out sexually to numb those feelings. Immediately after, the high wears off and shame kicks in. I can't believe I did this again. What is wrong with me? So what do you do with that shame? You hide, you isolate, you keep secrets, and you project it onto someone else. And that creates more pain and more difficult emotions, which leads you right back to the beginning of the cycle.
And when you're stuck in shame, you kind of negate your responsibility, which creates more damage. You really have to address the shame for you to get better.
So let's talk about guilt versus shame. It's important to distinguish between the two. Guilt says, I did something wrong. And this is helpful because it can lead to apology and change. So instead of saying, I did something wrong, shame says there's something wrong with me. And this is destructive because if you believe that there's something fundamentally wrong with you, then you're also going to believe that you can't change. You need to move from shame into taking responsibility. You're a person who's struggling with destructive behavior. You are not your behavior.
So let's lean into guilt. Take 100% responsibility for the actions and behaviors you've done. That isn't to say you're a bad person, but you want to own the behavior.
The antidote to shame is not willpower, it's connection. Shame thrives in the darkness and it dies in the light. Recovery begins the moment you tell one safe person the truth, and that person could be a therapist, a sponsor, or a trusted friend. When you finally say the words out loud and you're met with empathy instead of disgust, the spell of shame starts to break. Finally, we have some advice for loved ones. If you're watching this because you love an addict, we want you to know that your feelings of anger and disappointment are valid. You should just know that shaming them, saying things like, how could you be so disgusting, is really actually going to fuel their shame. Boundaries are necessary, but shaming is not.
So saying that you think the behavior is disgusting, not the person is disgusting, is what we're talking about here. We want to identify, and you can have boundaries around the behavior, no problem, but we don't want to do things that are going to destroy the other person and not allow them to heal.
And if you're the one who's struggling with addiction, we want you to know that you're worthy of recovery. You're worthy of living a life that doesn't have to be hidden. Reach out for help today.
Thank you for watching. If you like what you saw, hit the subscribe button below.
Or head over to becomingwellinstitute.com, where you can learn more about trauma, addiction, intimacy avoidance, or other related topics. Take a free assessment or set up a consult with one of our trained professionals.
Let us help you keep the journey toward becoming well going.